This book is very new illustrated atlas for threading and botulinum toxin treatment with the basis of the clinical anatomy illustrations with clinical techniques and procedures. For the utmost clearest comprehension, the structure of the face and neck by each individual layer is demonstrated. Furthermore, the injection depth data based on our anatomy publications and clinical experiences are provided in each illustration and multiple layered illustrations of the face and upper neck. This is not just a book, but a guide to perfect procedures.
Hello everyone, this is Dr. Na. My English name is Robin. I'm not sure how each country of the people watching this broadcast is in this corona situation. Well, we all wish this difficult time to pass safely. Okay, let's get started. Today, I will talk about the advantages of monothread and introduce new cannula type and scaffold type monothread. The first advantage is best for beginner putty training. Picasso paintings in the early days were faithful to the basics. But however, after the basics were established, his paintings began to develop their own personality. The same is true for cosmetic procedure. After training basic procedure, more difficult procedure become possible. There can be no result without training or experiences. So, how can you gain practice and experience in medical procedure? If you have a lot of members of family like this, it doesn't matter how lucky he is. He already has a lot of volunteers, but most families have fewer members like this. Can you practice him or her? I don't think so. After all, these two are the only ones left to each other. So, you need something that you can practice to be an expert while safely treating patients. There is one way. The way is to practice putting a monothread between the muscles and the dermis. And you can learn the sense of the procedure by your own hands. The sense is also useful when injecting filler with cannula or needle, like this. The second is there are no serious side effects and it is easy to remove even if it occurs. The curved thread can have serious side effects like this, like this, like this, due to incorrect placement. However, the side effects of the monothreads are bruising or being pushed out of the skin by incorrect placement. The third one is cost effectiveness, and we should not underestimate the capabilities of monothread. The goal of the monothread is making subdermal networking. So make a new fibrotic layer beyond the dermis. As mentioned before, networking is made using PDO monothread in the subcutaneous fat layer like this. There are two causes that make the effect. The first one is an immune response that occurs along the thread, which increases the fibrous tissue and contract by the myofibroblast. The second is that the resulting fibrous tissue is connected to surrounding tissue or fibrous tissue created by surrounding other threads. As you know, fibroblasts are placed by myofibroblasts upon physical stimulation, and myofibroblasts cause contraction of surrounding tissues. When the number of myofibroblasts generated increase, surrounding tissue has a vector along the long axis of the inserted thread, like this. As a result, the skin comes whitening and tightening. This is clinical evidence of connection with surroundings. You can recognize the result well on thin skin here under her eyes area. When she makes smile, she shows a region under her eyes like this. Can you see this? Since tightening is the goal, its results are natural. The process is similar to HIF or RF devices like Samaji or Ulcera. And let me introduce cannula type monothread and scaffold type multiple monothread. This is cannula type monothread here, and this is multiple monothread that made by braiding thread. And so, what's different? Longer and larger meaning more effective, like this. Thicker meaning the duration of stimulation is prolonged because repeated phagocytosis is required. The longer thread length can expect a greater force of the myofibroblast along the long axis of the thread. The three-dimensionally made fibrous tissue reinforces the surrounding tissue like this. This meaning end scaffold make like this effect. Now let's take a look at the procedure technique. The cannula type makes networking by inserting multiple threads with one insertion point. I usually insert 10 threads each into 5 entry points like this. Entry point, 5 entry point, and I usually insert the cannula type thread, 10 threads each point like this. And I mainly insert the end scaffold in the area where I want to strengthen the tissue. For example, under eye area and marionette line. Reinforce the orbital septum or orbicularis ocularimus. Insert the end scaffold like this. And for the marionette line, the folded skin due to lack of elasticity, I inject the end scaffold like this. Yeah. Let's take a look at the demonstrations. Okay. Play the video. As you know, not all face can be anesthetized, but nerve block is effective in the central part of the face. So, improve the foramen and, okay, it's too fast. Oh, sorry. Uh-oh. Uh-oh. Can you fix it? Okay. Improve the foramen and canine fossa area when mark for the local nerve block, and then inject the lidocaine . Inject the lidocaine for 3 point for central area anesthesia. And then inject lidocaine about 0.3 or 0.4 each area, each point. And then intradermally inject the lidocaine for entry point anesthesia, 5 points as mentioned before. As you can see, this volunteer is already have acne scar, so it is very hard to advance the cannula or needle, but I can do that. As you can see, I placed the cannula type monothread through the 1 point. Okay. She already have anesthetic injection, but first time injection for nerve block. I usually not the anesthetic point intradermally. This is for the we don't need any marking. And then subdermally inject the cannula type. Procedure is very simple. Procedure is very simple, as you can see, it's very simple. But as mentioned before, this patient have already acne scar, so it is very difficult to advance the cannula. But gently and slowly advance is capable for this procedure. I placed the cannula type monothread from the entry point radially, so it is making networking each other entry point injected PDO thread. Even non-cog PDO to avoid the side effects such as skin pushed up by thread. I always insert the thread cannula vertically, like this. I usually, when I place the PDO thread, rest procedure is spin the cannula because is avoid the side effect like push up the skin. Is make some place the thread to more shortening, so it avoid the side effect. Vertically engage and then inject under subdermal fat layer, and then spin. Same procedure repeated. I always don't think make the improve any local problem. I always think about the face, whole face. So I don't think my procedure make better than local area. For example, nasolabial fold, marionette line. I just make improvement of whole face, tightening and whitening and rejuvenated face. This is N-scaffold. Lidocaine inject into the dermis, same as above. Inject the scaffold under the orbicularis muscle. Be careful the PDO thread not to be caught in the muscle, orbicularis oris muscle, because it is possible the inserted thread to be visible when the patient make a move on face, like smile or like animation to move the periorbital area muscles. This is vertically inject the marionette, vertically inject the N-scaffold. It means tightening of the perioral area, so is more improved the skin tightening and marionette line. So I want to show you the case. This patient is 55 years female. He got the two N-scaffold each area, and then 3 months later is improved before. And then same as before case, we can see the tightening under her eye area like this. And then this patient, 48 years female, I want to more improvement of marionette line, so I using 2 N-scaffold each side, and then 4 weeks later and 12 weeks later. She satisfied this result. And 65 years female using 3. It's the same. No. Who changed the mind? This sorry. And this is compared with monothread needle type and the cannula type. It's just this picture immediately after the procedure. Unfortunately, even though it is needle type, it does not cause bruising. But right side is cannula type, and left side is needle type monothread I used. After 3 days, the lower left cheek is more swollen, as you can see. And then 1 week later, it looks like normal. After a month, the patient felt whitening and tightening on both sides, but recommended a little more tightening on right side. As you can see, the last picture shows more tightened and more smaller than before. Can you see this? Okay, this patient, same comparison by the needle or cannula, needle and cannula type. The right side needle, left side is cannula type. Just immediately after and then 3 days, low right cheek is more swollen, and 1 week later, 1 month later, the patient felt whitening and tightening on both sides. It's the same result, and is satisfied. The patient is satisfied the result. Oh no. This is. Thank you for your attention. That is my last slide. Any question and for argument for me, please give me a give me a question, please. Actually, I think is it not in the we can see the textbook, but I feel I feel and the patient said about the 6 months is average 6 months, I think. So, as mentioned before, about the 6 months is long resting for effect. So, I recommend my patient about 2 or 3 times 1 year. I recommend it for my patient.
Hello guys, unfortunately time is up, so we're gonna end up from here. If you have any more questions, please reach out to the mfinders at mfinders.com. Thank you so much and have a great day.
내 슬라이드 왜 막